In this recording, we will cover one parasite, Blantidium coli. This is the only ciliate we will cover for this course. It is the largest parasitic protozoan known to man, and if you flip to your scale drawings of the parasites in your note set, you'll see how large this is compared to the other protozoans we've discussed. It is definitely pathogenic, but it's self-limiting, so it doesn't progress and have other organ involvement. The most common host is the pig. So we're an accidental host. It is transmitted by fecal-oral route of transmission. They inhabit the large intestines, and there is mucosal and submucosal lesions that can occur. So this can be pretty devastating. However, there's no extra intestinal phase like there is for Entamoeba histolytica. The life cycle is similar to the amoebas previously discussed, where there's a cyst and a troph stage. The cyst is infective, and both the cyst and the troph are diagnostic. Both the cyst and the troph stages have two nuclei. There's a macronucleus and a micronucleus in both of them. And the macronucleus is described as being kidney bean shaped. Often you cannot see the micronucleus in the stain smears or even the wet mounts, but the macronucleus will always be obvious. The troph is very large, oval shaped, covered with cilia. So it moves in a rotary motion. It also contains a structure called a cytostome, which is a mouth located at one of the ends, and it may contain vacuoles. And that makes sense that the cilia would be on the outside because the troph we know is the motile form. So I have two pictures here, both show structures better than the other. So on the left, here is a very well stained macronucleus. On the right, it's not as prominent, but you can definitely make it out. Here's the macronucleus. And neither one of these can you see a micronucleus. The picture on the left has a really good cytostome. So it's this little indentation. The one on the right, it's pointing to a cytostome, but I can't really make it out. The picture on the right is showing the cilia very well, so you can see the little hair-like projections. Then the cyst would again be the infective stage, and it's the environmentally resistant stage. So remember, cysts can survive for weeks in the environment, and it does that by having this protective shell or protective cell wall. And you can see where the cilia are retracted inside the cell wall. And this concludes the end of this lecture.